A dental matrix band is a thin strip of metal used by a dentist to help place a dental filling. It's used to place both white and silver fillings. A matrix band is used like a concrete form. If you ever watch construction workers pour concrete, you may have noticed that they build a form to hold the concrete as it sets. Dentists build a form as well when they fix certain areas of teeth. I use a matrix band when I'm placing fillings in between teeth and in areas that are under the gums a bit. Years ago, the most common type of matrix band was the Tofflemire matrix band. It's a thin strip of stainless steel that is placed in the Tofflemire retainer, forming a loop. It comes in 3 different sizes: regular, which is the one that is most often used, pediatric for working on deciduous, also called baby teeth, and the extended version, which is used for when the filling extends deep under the gum line. Once the band is securely in the Tofflemire retainer, it is then placed over the tooth you are filling and tightened. A wedge made of either wood or plastic is placed between the teeth to make sure that the bottom edge of the band is pressed tightly against the tooth. This type of matrix band works very well for placing silver fillings, since the silver filling material has to be packed into the cavity prep. The packing action ensures that the side of the filling is tight against the neighboring tooth. Dentists call this having good contact. If the filling does not have good contact with the neighboring tooth, you are more likely to get food stuck in between the teeth. When white fillings started becoming popular, this was a problem. Since white filling material is soft when it's placed, it was very difficult to make good contact with the neighboring tooth. Various workarounds were tried, such as making packable composite, which didn't work very well, and various contact forming instruments to help create tight contacts. The instruments were placed into the white filling material while it's still soft, then pressed up against the neighboring tooth and held there while the white filling material was zapped with a curing light to set up the material. This method worked better than the packable composite idea, but it was still not ideal. Sectional matrices are one of the things that finally helped white fillings become more mainstream. These are small pieces of thin metal that get placed between the teeth you are filling. Early versions of sectional matrices were just small pieces of curved stainless steel. Later designs incorporated little handles on the top edge of the matrix to help to make placing and removing the matrix easier. The sectional matrix is placed between the teeth you are storing, and a wedge is placed as well. Since the matrix doesn't go all the way around the teeth, you use a spring ring instead. The spring ring secures the matrix in place and also forces it tightly against the neighboring tooth. This is what I use the majority of the time when I place white fillings in back teeth. The only downside is if you don't seat the spring ring properly, it can go boing off the tooth and fly across the room. Early spring rings were made out of steel, and the tines were fairly small, so you couldn't use them to place wide fillings. Newer styles of rings are made of nickel titanium alloy that stays springy for longer. The tines are also broader and V-shaped so that the rings stay in place better. The broad shape also enables me to restore wider fillings. The latest innovation in dental matrices is the greater curve band. It's similar to the original Tofflemire matrix band, but it has a slightly different shape. As you can see, it has more of a curve to it than the traditional Tofflemire matrix band. This small difference makes a big difference in the mouth. Now the bottom edge of the band will seal around the tooth tightly without needing a wedge. Due to the greater curve in the band flares out more and will give me a good contact when I use it to place a white filling. I use it in a traditional Tofflemire retainer, but I use the retainer upside down. This lets me really cinch the band tightly around the tooth. I also like using the greater curve band when I'm placing fillings on front teeth that extend below the gum line. The greater curve band will hold the gum out of the way and create a good seal around the tooth so I can place a white bonded filling. It comes in a regular size and in a wide size, so you can use it on almost any tooth. To see a video of me placing a white filling while using the greater curve matrix band, click here. Thank you very much for watching. See you in the next video.